All right, folks, thanks for joining us. My name is Steve Stone from Rubrik Zero Labs. Really appreciate you joining us again on this series. We're going to do two things really different from what we've done previously. First, we're going to change the name of this. We've been Cybersecurity Decoded. We're going to flip that to Data Security Decoded. Why are we doing that? Well, it turns out we just have been talking about data over and over and over again, and that's a topic of growing importance across the industry and here at Rubrik, and it's what we specialize in. So we're just going to really focus on that moving forward. Second thing we're going to do, we're going to change a type of guest that we've never had before. Up to this point, we've been very lucky to be joined by senior leaders across the cybersecurity industry, and we spent a lot of time talking about their experience. Today's guest is not from the cybersecurity side of the house, and I couldn't be more excited to hear what she has to say. We're delighted to have Hannah Neprash join us on today's episode. She's an esteemed assistant professor from the University of Minnesota's School of Public Health, where she specializes in health economics, in particular focusing on the dynamic responses of healthcare providers to financial incentives and non-financial incentives. Her academic journey started with earning a PhD in health policy from this little mom and pop place people may have heard of, Harvard University. I think I'm getting that name right, to impactful policy work with the Medicare Payment Advisory Commission and the Health Subcommittee for the U.S. House of Representatives Ways and Means Committee. In her research, Hannah has utilized novel data sources exploring how decisions are made by clinicians that influence healthcare utilization, spending, access, and quality. This has led her to have a keen interest in the intersection of healthcare and cybersecurity, especially the effects of ransomware attacks on hospitals and patient care, a topic she has both studied and published on extensively. Her insights are shaping how future policies could protect patient data against this rapidly evolving backdrop of cyber threats. Enough of the intros. Hannah, thank you for joining us. We're really excited to have you here.
Same. Thank you so much for inviting me on.
Well, I've got about a million questions, so I just would love to dive right into it. Before we jump into the complexities of cybersecurity and its impact on healthcare, I'd love to just kind of hear what initially drew you to this field of health economics.
Yeah, that's a good question. It's been a while. I would say it started when I learned that we spend basically one in every $5 in the US on healthcare, and we aren't the healthiest country in the world. So I thought that was really motivating. I think I'd also watched a lot of a show. This ages me or dates me, but I'd watched a lot of this show called The West Wing where they like walk and talk about policy and politics. And so after college, I moved to DC and I got involved in health policy. And health policy is really health economics because of this incredible spending that we do. So that's my origin story, so to speak.
Well, I love anyone with an origin story. I love that term. I'm curious, based on where you started there and that interest, what inspired you to really start exploring this ransomware topic, and how have you incorporated that into both your research and your curriculum?
Yeah, great questions. I, you know, honestly, the start of my interest in ransomware is another podcast. I listened to a podcast in 2021 that had an interview with someone whose job it was to negotiate ransom payment or the lack thereof, between hospitals and cyber criminals. And I had never heard of this particular threat in healthcare. Part of that is because, obviously, cyber attacks in healthcare and the COVID-19 pandemic kind of happened hand in hand, at least expanded hand in hand. And so it occurred to me that this was an area where nobody I knew was doing any research, and it potentially had tremendous impacts for hospitals, for patients, for policymakers. There was a lot of opportunity, and that essentially kicked it off. I find that in terms of how this gets into my teaching, I teach a lot of students who are going on to become healthcare administrators. And this is something they need to know about. They need to know about data security. They need to know about cyber threats. And they didn't need to know about that maybe a decade ago, or at least it wasn't quite so high up on the radar. And so I find that they are already really tuned into this. I don't have to make a sell to them. They understand that this is an important issue, and it's really fun to talk about in a classroom too.
It's really interesting hearing how you're effectively growing the next generation of public health leaders there, especially coming from our side of the house on cybersecurity and how we look at threats. But I'm a career analyst, a career researcher, so I'm just fascinated by that, and I would love to start with that. Your work at University of Minnesota has shed light on these impacts around patient health outcomes from ransomware. But I would love, before we dive into the results, I'd really like to hear if you wouldn't mind walking us through how you and your team approached this research. How did you even get this outcome, and what was your methodology?
Yeah, this was unusual for me. So, as a health economist, I tend to work with data that already exist. So, I work with, data sets of hundreds of millions of electronic health records, for example. And when I started this project, there was no comprehensive data set of ransomware attacks on healthcare providers, at least none that was available to me. And so, step zero really was creating that data. And that was a year long process, painstaking. I involved lots of students in essentially collecting every single news report we could get um, of incidents where hospitals and other healthcare providers went through a cyber attack. So that was the first step, and then we took this list of all the hospitals in the U.S. who had experienced a ransomware attack over about 6 years or so, and joined that to data from the Medicare program. So, Medicare, of course, being the public health insurance program for the elderly in this country. And there's a giant data set created whenever a Medicare patient goes to the doctor. And that is data that I work with a lot, actually. So, combining those two data sets allowed us to look at things, to essentially answer the question, what happens to patients when their local hospital has a ransomware attack?
One of the things that really jumped out to me, and why we really wanted to speak with your team, was this focus on impact, actual patient care impact. On our side of the industry, we focus on intrusions and outcomes and those kinds of things. So when I look at the findings from your team, there's real measures around drops in patient care levels, assessments on actual loss of life following these ransomware events. Would you mind delving into how you think these findings can potentially influence future healthcare policies, or else these emerging leaders you talked about as students?
Yeah, so it's funny to hear you say that because I think when I've talked to people who work in cybersecurity on, within healthcare organizations, I would say I get a response from them that, in a few more words, they're very polite about this, but they tend to say something along the lines of, well, of course it's bad when this happens. Of course more patients die. Of course hospital revenue drops precipitously. And to me, that isn't really a given, right? You kind of have to. My all of my training says that you have to approach a question open to all possible answers. But you're right. The answers that we found are striking. It when a ransomware attack hits a hospital, it just knocks the wind out of them completely. You see emergency department volume drop by about 40%, inpatient admissions drop by about 20%, and for the patients who are already there, unfortunately, they are more likely to not walk out of that hospital alive. And there's a lot of stuff going on, right? It's a combination of ambulance diversion, loss of access to electronic health records and other, data sets that they rely on. Loss of imaging equipment, all sorts of electronic systems are taken out, and of course, every attack is slightly different, right? If you've seen one, you've seen one. Um,
Yep.
but for policymakers, I think this is, this kind of lights a fire. There's a difference between anecdote and news reports and actually being able to say, uh, due to ransomware attacks, almost 60 Medicare patients died who would not otherwise have died if there hadn't been a cyber attack. So having concrete numbers, I find, and this is true, this is from my own experience in policymaking, but also from talking to policymakers about this research. It really helps to be able to have numbers to attach to a problem they already are aware of, and that's kind of how you get something to rise to the top, and hopefully produce some sort of meaningful change.
Yeah, I'm personally very excited to see your results and the focus on policy because it matches my own career in this other area where there's a story I've told over my career. The first time I had to brief a four-star general when I was in the intelligence community about this intrusion and what it meant. We walk into this very senior leader's office and there's no computer. This is not even a digital native. This is a incredibly senior leader with immense power and responsibility to shape the globe, and there are no electronic devices in their office. And the ability to convert meaning is really, really critical. So I was really excited about that in your work. Before we kind of dive into some more of those specifics, just as a researcher, there's one more question I'm just dying to ask. When you saw the results and you talk about approaching this open minded, how close were your results to what you expected? Was there anything that just surprised you one way or the other?
Yeah, there are always surprises. So for me, the big surprise was, um, and maybe this is really intuitive to folks in the cybersecurity community, but the surprise to me was that the victim is not just the victim, and what I mean by that is that um, let's say I live in Minneapolis. Let's say there's one hospital in Minneapolis that goes through a ransomware attack starting right now. That it doesn't just affect the attacked hospital, right? There are these spillover effects to everybody neighboring that hospital. Those other neighboring hospitals have to absorb a bunch of patient volume, right? They have to see all the folks who would have gone to the attacked hospital's emergency room and can't now because they can't use their CT machine. So I think finding that this is a problem that really spills over to your neighbors, even if those neighbors didn't go through the ransomware attack themselves, that was a surprise for me. What wasn't a surprise, I expected effects on health outcomes, right? I thought that, based on what I'd heard about what happens in a hospital during a cyber attack, I would have been pretty surprised to find that patients, were unaffected. So in that way, I wasn't surprised to see that there are pretty harmful results for the patients who were there.
One thing I'd be curious to get your opinion on is, as we've done our own research, at Rubrik Zero Labs, and this intersection of where our researchers are kind of matching is, we're looking at like the blast radius of a ransomware attack. We can effectively measure that, and very much in the same vein of what you're talking about, provide hard data and ideally context. And one of the things that we see is, across 2023, in a typical ransomware attack against a typical healthcare organization, so lots of generalizations there, but shooting the mean and median, we're looking at that a hospital in a single ransomware attack loses about 20% of the sensitive data. That's patient records, that's billing, that's personal data, that's all of that. And the ability to measure that and say, yeah, it's 8.5 million sensitive data records, that's about 1 out of 5, that helps us really, hopefully, advance the discussion. And I'd be curious in that context, if you wouldn't mind giving, kind of your assessment, your hypothesis, if you would, on what you see from a patient health, a policy, whatever the right mechanism is. Do you see direct consequences from these data breaches and from our perspective, substantive loss of patient and personal material?
Yeah, that is a striking number, and that is, I mean, enough to wake up any healthcare executive, I imagine. So that's actually a question that I'm looking into right now. I am really curious what happens to patients as a result of those those data breaches. The research I've done so far is very short term. Looking at what happens in the week, 2 weeks, 5 weeks after an attack. But probably it takes a little bit longer for the consequences of the data breaches themselves to show up for patients. So what I'm really excited to do, and I'm happy to keep you posted, and I would love to, hear your reactions to this research as it evolves. I'm really excited to merge on some credit reporting data and see, does identity theft go up? Do other financial outcomes suffer for patients when this data, is stolen and potentially made public? The other thing that you mentioned is, the theft of really sensitive stuff like diagnoses and, what treatments have folks received. I think of that especially when it comes to, mental health care, right? There are all sorts of things that people would prefer to keep private. And I don't know how you measure that effect except to say that any patient you talk to does not want that exposed. And so I think that, there are definitely consequences for patients of the data theft as well.
I'll be fascinated to see your research. I think the academic side of the country will be able to hopefully answer those questions better than we've been able to in industry. And I'll give you an example of where it hasn't worked for us. Several reports ago, about this time last year, we tried to look at that. We looked at like sensitive data and try to compare and actually provide some form of assessment for regulatory and legal policies. And the problem we ran into was the numbers were just too big. They were unrealistic. We could say, yeah, we expect that a stolen or lost record, this is what a typical fine is. But then we compared that to the actual data. It was so big, it almost became less than useful. So I hate to speak for the entire industry, but I will because I'm the one with the microphone now. We've really struggled there. I don't know that as a cybersecurity or data security industry that we've provided any real credible touch point there, and it is not for a lack of trying. A lot of smart folks at a lot of places have really struggled with that. And then if I could kind of bridge that into the first part of your career on health policy, I'm really fascinated. We in the data business, policy is a big deal for us. You've got regulatory, you've got SEC, you've got GDPR. I mean, we spend a significant amount of time trying to do that right, anticipate, and hopefully help guide better legislation. Based on your background in health policy, how do you perceive the current regulations, particularly in the U.S., when it comes to cybersecurity, healthcare, kind of anything in that big jumble?
Yeah, I think the policy environment is really behind the curve on this. And part of this is the fact that, the threat evolves every day. Um, but part of it is also that there has been a disconnect, I think, between health policy and cybersecurity policy. Obviously, my experience is in the former, but they haven't really had to talk to each other much until fairly recently. And so they're kind of, everybody's still figuring out how to speak the same language. But one, let's call it a silver lining of the Change Healthcare attack that just happened, is that this is really on the radar of plenty of federal policymakers, state as well, I'm sure, but especially the federal folks who are gearing up. I think I have heard, I hope, to make some substantive changes sooner rather than later. And of course, it's a hard problem to get your hands around, but it's also someplace where there's so little policy that any step forward can be a big one. So my guess is that we will see pretty soon minimum cybersecurity regulations for healthcare providers, probably for insurers, probably for some third party companies. It will be interesting to see how that evolves. But, right now it really is a wild west and organizations choose what they want to invest in. And I think it is becoming clear that we have to set a floor for that. So that's my kind of best guess on what we see first.
I think that very much matches kind of our experience. I mean, one of the things that we've seen and we've debated about quite a bit in industry is, about this time, we talked about over the course of 2022, how many organizations had to conduct a formal data loss notification, exactly what you're talking about. And, in 2022, that number was like a little more than 50%, like mid 50s, variation in numbers based on research. When we asked that about 2023, we saw numbers that really shocked us, like in the 90s, like 90+% of organizations at some point had to conduct a formal data loss notification. And that could be a breach, that could be a bunch of things. And and I think that's actually a healthy thing because it's exactly what you're saying. It's you can't understand the problem until there's public touch points and you can research it and you can really understand, and that's really been a big thing for us. One thing I think is really interesting, and I would love to kind of kick back over to you on the cybersecurity and data security side of the house. We are not short of opinions on what shortcomings there are in healthcare. You don't have to look very far to find someone with a very strong opinion on that. But I'm curious about the flip side. What do you think the healthcare industry thinks of the shortcomings on the cybersecurity and the data security side of the house?
Uh, Yeah, good question. First of all, I agree with you. Like that the 93% number is stunning. But but I think there's a silver lining there too, which is that there's no longer a stigma in, you know, experiencing these events, right? Nobody wants it to happen, but the fact that it's everywhere all the time means that it shouldn't be something you have to keep quiet. We can talk about this. We can all share best practices and, make some progress, right? You don't have to hopefully hide it too much because it really is everywhere, and maybe we can reduce that for everyone. Um, right. So it's a unfortunately, my answer to that question is that I suspect that most people in healthcare, certainly clinicians, just don't think about cybersecurity. You know, I suspect that, and this is from talking to friends who are physicians around the country. A lot of them are in academic medicine. When I tell them what I'm studying, they say, "Oh yeah, I've vaguely heard of that, and I just started having to use multi-factor authentication, something like that." It's essentially, I don't want to say annoyance, but it's, when they wake up in the morning, they want to go to work and take care of their patients. And it's a bit of it has been a wake up call, I think, to understand that cyber safety is patient safety, and that is not my phrase. That's a phrase that I have learned from the cybersecurity community, I would say. But that's kind of a new lesson for folks who are, especially for clinicians, I think. They're just very much in their own world, and unfortunately, that I think makes healthcare it's one thing that makes healthcare such a ripe target for this sort of threat is the fact that people aren't necessarily, their first concern is not, is this a phishing email? Their first concern is, oh, I really need to see, Mrs. Smith's uh, X-ray result. Um, and so I think that there's just so much room to improve.
Yeah, that's fascinating in many ways, and it kind of makes us, I think, in the industry feel like the little brother, like trying to get the older siblings' attention. Like, please, please, this is really, really important. Uh, you said something really, really that caught my attention there. You talked about, a lot of these leaders on the clinician side, they want to take care of patients, and we pair that with other things we're talking about, just the heavy prevalence of ransomware against healthcare. We have these real impacts that we see on both sides. How do you think this looks in the long term? I mean, do you see long-term consequences for healthcare facilities after they experience a significant, ransomware event? How do you think that will affect trust, retention, financial health of these organizations?
That's a great question, and something that I also, is on my to-do list of research topics. Um, I think there are certainly reputational concerns, and trust is everything in healthcare. I suspect that patients vote somewhat with their feet, right? If you don't think that your local hospital or clinic is a good steward of your data and you have options to go elsewhere, patients may. Um, I certainly hope they do, right? Like that's an important thing. Um, I question whether how aware patients are of some of this, right? I don't. I'm curious what you think, actually. Kind of data breach notification. Does that make it through? Or are we all just getting so many letters, saying your personal information has been exposed again? I'm curious what the average patient makes of that. But in terms of long-term effects for the organizations themselves, I think there's a real financial harm here. I mean, what we find is that the average ransomware attack for the average hospital, and again, you're right, talking about averages is always going to leave out some of the outliers, but on average, it's about 1% of operating revenue that they lose during 3 weeks of the attack, because they just can't care for the volume of patients that they usually see, and so they can't bill for it, and the revenue doesn't come in the door. And 1% might not sound like much, but margins in healthcare are actually pretty slim. So I don't know. I mean, I've never run a hospital personally, but I have to imagine that at the end of the day, you got to balance budgets, and if you're losing some of that money, you have to economize elsewhere. And I think there are lots of you know financial decisions that hospitals and other healthcare providers might make that could lead to lower quality care potentially. So again, these are kind of longer term effects, and so still need a lot of research, but these are pretty devastating events when they happen, and it's not just a short term recovery. They get back to normal in about 4-ish weeks, 3 to 4 weeks. But I think that long-term recovery looks a lot different, and I suspect that you all have a much better view into that picture of kind of what happens in the aftermath.
Well, Hannah, I have really bad news for you. We don't, and again, I'll speak for the whole industry, which is always dangerous. I think we struggle there. I think we struggle there. And to answer your question on that perspective, I think there's a few things. I think one is very much I think there's a lot of burnout at the individual level. People are like, I got one of these letters already, and one of the things I think we have not done well is provide context. We have not done well saying we're great at saying, hey, here's the thing: your identity has been compromised. There was a breach over there. I think effectively we've got that pretty nailed down. We're pretty great at that in the industry. We're awful, in my opinion. We're awful at saying, does this matter or does it not? And if it matters, here's why and how it matters. And we're not great at that to individuals. And we're also not great at that to organizations. We've got a proven track record of saying, hospital X, you're breached. Patients ABC, your records are compromised. And then we kind of tend to walk away. And I think there's a lot of work to be done here on why this matters, how it matters. And my own personal concern is we're going to kind of miss the moment. This is so prevalent, and it is. We've actually done a number of studies here at Rubrik Zero Labs and so have other industry partners that like people are burned out. The burnout's real. The intrusions are wearing out experts. The notifications are wearing out consumers from an industry perspective, and that really runs us a danger of shooting past our window of driving meaningful change. It's hard to solve a problem when people don't even want to hear about it anymore. And I hate to use analogies in research, but one of the things I think is analogous is I started my career working Chinese espionage primarily, Chinese espionage against US government and our allies. And one thing that we saw was everybody got burned out. It was such a pervasive problem. It still is. I mean, there's recent testimony here in the US to that. But people just got tired of hearing about it. They got tired of talking about it. And so there was a desire to talk about anything else. So we talked about other stuff, right or wrong. There's a really big debate in industry on that. And in the meantime, this activity still kind of happened. I am personally concerned about that. I'm concerned we'll have our China moment, particularly with healthcare. I just think there's a real impact and opportunity there that can get missed. So a very long answer to your short question, But I would like to kind of take some of that and shift it a little bit and really get your perspective from the other side. I mentioned we have lots of opinions about healthcare and cybersecurity, data security. We spend a not insignificant amount of effort trying to anticipate the next challenge. How do we help solve the next breach? How do we help serve healthcare? And I think our track record, if we're being honest, is mixed results there. I'd be really, really interested in your perspective. What are the problems and the big challenges you see in healthcare that those of us on the tech side could potentially help? And if you think we're prepared to help there.
Yeah. I mean, so healthcare kind of got dragged kicking and screaming into the 21st century, right? Like people were using paper records a lot longer than they should have been. And really the adoption of, electronic health records had to be incentivized at the policy level with, a combination of sticks and carrots. So I think that, and now healthcare leaders are maybe thinking some version of this we wouldn't be in this jam if it weren't for the fact that everything is interconnected, and we don't even fully understand the range of attack surfaces, right? Like it's just so in some ways I think the best thing would be just reducing the complexity, right? There are a lot of uh, recommendations for um, steps to take in order to reduce the likelihood of some of these cyber attacks, and helping places prioritize, especially helping the settings where they really have to stretch a dollar pretty far. So here I'm talking about maybe rural hospitals or safety net clinics. What if they don't have a ton of cash, what should they do first? I think that kind of prioritizing is a thing that would be really helpful for healthcare leaders who certainly aren't experts in the way that you are, right? And are kind of coming to cybersecurity and questions around data security from the perspective of wanting to keep the doors open, the lights on, and the patient safe.
I think that reduction word's really important, and I think we're late to need on our side on the tech industry of this is, we looked at healthcare specifically and what's unique, right? Everything's unique, just like everything else, but there are real differences, and I think one of the things that just I couldn't get past when we were looking at healthcare data is healthcare sensitive data is growing at 5 times the global average. It's growing at 60+% every single year. You use that surface area term. That's a massive amount of risk surface area, and I think you're right. Like it's an impossible task in many ways. There's just no way a rural hospital can compete against these well-crafted, well-resourced cyber criminal groups and defend that kind of surface area. It's not going to happen. So I think we definitely have to find better ways to do that. And I'm very hopeful that we can. But time will tell, right? So I've taken a bunch of your time. I've loved all this. I could ask you just literally 1,000 more questions, but I'd like to kind of end on one. I'd like to kind of go back to the beginning and get your take on as you've learned more about the cybers, as we call it. That's a tech term, by the way. Cybers with a Z, definitely a
Of
technical term.
course.
As you learn more about that and your research, how has that shaped your thinking? Have you changed the way that you think about this, and how does that shape your worldview?
I would say that I learn something new every day, and it changes how I think about it every day. I mean, this is a I think I've learned that this is truly, what people call a wicked problem, right? This is it would be naive to say, and I think you kind of I'm really just paraphrasing what you just said, right? It would be naive to think that this threat will go away or that we can reduce it to zero. Um, I think there are a lot of, we can definitely be better prepared, but some of that preparation I have learned is also, what to do when there is inevitably an attack, right? Kind of how to reduce the severity, how to respond. I think that I went into this naively thinking that most of the policy should be about preventing these events, and I still think that's a huge goal, but I think it's just as important. I am learning to prepare for this some level of inevitability, and respond quickly and in an evidence-based way. So I'm still kind of learning what that means, as are federal policymakers, obviously. And of course, every day it seems like the problem changes. So that is a fascinating thing that I at least cannot look away from right now. Now that I know it's there, I learn something every day. I really do. And conversations like this are so valuable too. I think that just getting healthcare people to talk with cybersecurity people, if we could just get that to happen on a regular basis, the kind of policy path forward would be much clearer.
Well, I gotta say, Hannah, you're learning much faster than many of us in the industry. I remember I was in a different team. I was really happy with this team, and our job was to identify all the evil that we could see. And we spent years trying to do that. And I'll never forget. There's one of the best analysts in the industry. A guy's name is Steve Miller. Him and I were having a conversation one day, and he's like, "We're never gonna find it all. Like it's an impossible task. It will never happen." And we had an excellent team, excellent tech. We were uniquely suited to solve the problem, and we had to change our whole thinking. That the task we were working on for years was find all the evil, and it's just not going to happen. So then we had to really kind of start shifting. And I think you're thinking about, well, now what? What happens now? How do we make that meaningful? Is absolutely where our paths have led us on this side. So, Hannah, I agree completely with your last statement that I think these kinds of conversations are how we are going to solve this. I really think it's going to take all hands on deck, all expertise. And in that vein, I would just love to say thanks again for joining us on this show. Thanks again for allowing our team to leverage your team's research. We think it's critically important to solving these really complicated challenges. And if we can ever pay the favor, please let us know, because this has been immensely helpful, and we're very excited for this time with you.
Well, and likewise, thank you for amplifying our research. It what's the phrase about a tree falling in the woods? We do this, I think, because it's important, and because hopefully it can affect everyday life and how healthcare is actually provided. So I love having these conversations, and I really appreciate the invite. Thank you.
Well, thank you, Hannah, and we're super excited for your next round of research. Thank you very much.